Welcome back to MidPoint. We will continue with our regular programming in just a moment. First of all, though, let me bring you some more information on the breaking news that we discussed a few moments ago. It first came out from the Associated Press that there is a new video appearing to show the execution of the second American killed by a self-professed member of ISIS. This is Steven Sotloff. He is the gentleman. He is another journalist, a video journalist, who lives in South Florida. His parents have been discussing this. They have been begging for their son's life now. There have been a number of reports about this, but there is an internet video that has now been released that purportedly shows the beheading of Steven Sotloff by Islamic State group members. It first came out from Associated Press. It is now being also reported by ABC News and others. Again, this is all just coming in on the fly. John Bachman is in the Newsmax newsroom. He will, of course, have something for us on Newsmax now at the bottom of the hour. We will continue to keep you updated on this story as it breaks. Let us go ahead then and continue with our current programming. The Congressional Budget Office recently issued a report that looked at several facets of Obamacare, and one item regarding employment might cause some pause in the White House. Then again, there are those noting that no matter how you slice it, the health care initiative is working and even cutting the federal deficit. Let's put some fact to the discourse now. Welcome into MidPoint, board-certified physician, recipient of the Patient's Choice Award in 2008-2009, and a keen eye toward the politics of healthcare. Dr. Elaina George joins us. Dr. George, thank you so much for being here.
It's a pleasure to be with you again.
Dr. George, what do we make then of the CBO account? Because when the CBO first put their report out recently, there was some saying that the report now shows that more people are out of work because of Obamacare, that there are fewer people now working because they can't afford it. But now the CBO seems to be pulling back a little bit on that report as maybe not being accurate. What do you know, and what's the fact in here?
Well, the fact is a lot of people have not signed up for Obamacare, and those that have, they're not happy with what they have. And I think the numbers that are out there don't really reflect access to health care. I've said this before, that having health insurance does not equal having access to quality health care. And what we've seen is a cost shifting from the insurance companies to the patients. And I can tell you as a practicing physician, people who have this insurance come into my office, but they find that they're not covered or they can't afford to be treated.
Here's part of the report here. The CBO expects the rate of labor force participation to decline about 0.5 percentage point further. And they're saying that this comes from Obamacare, from the health care initiative, that people simply, the subsidies act as an implicit tax on work, so therefore people work less. Would you agree with that supposition?
Absolutely. It actually locks people into lower socioeconomic status, because in order to qualify for Obamacare, you basically have to be about 400% above the poverty line, which means it makes sense not to work. And if you actually do get a subsidy, what they don't tell you is if you do well the next year and you get a raise, you actually have to pay back the subsidy that you got the year before. So it is essentially a tax, and people have been promised things that were never going to be delivered.
What about the left, who says that people shouldn't be locked into jobs they hate because it's the only way that they can get health insurance? They seem to want to explain it away at that case and say that it really isn't a bad thing if you look at the long-term effects of Obamacare.
I think that's extremely simplistic, and we're talking about people's lives, and we're talking about the quality of life. And they're saying basically that you should not work because you have options under Obamacare. Well, it's disingenuous, to put it mildly, because I can say specifically that people have been promised coverage, and when they try to access the insurance, it gets denied as medically unnecessary or a service that was never covered at all. So good luck to the folks who actually do end up in this system, because it's not designed to pay for anything. It's just designed to take your money.
Is it fair to say that if you make any prediction right now in relation to Obamacare, we have seen things change so many times. We've seen numbers change, we have seen ideas change, we have seen claims change. But simply stated, is it maybe the fact that there's just too many variables right now in the early stages to really give us that accurate forecast on either side of the argument?
Oh, I think the die has already been cast. We're now entering a medical system that's becoming a two-tier system. Those folks who end up in the Obamacare or the accountable care system actually have less choice, don't get to pick their doctors, have to pay for the privilege, and we're seeing an exodus of people who can afford to opt out, and go to independent physicians who are now having a fee-for-service model which actually is cheaper and higher quality. So we're going to see a self-selection. Those who can afford to will leave it, and those, unfortunately, who can't will be stuck in it.
Regardless of what the CBO says or what the Medicare numbers are, is it your opinion then, and I know as a physician, it is always that idea, you want to take care of the patient. The physician's most important job is to care for the patient no matter what the cost is, no matter what it means to the doctor themselves. But is it your experience, in your opinion, that a lot of doctors simply, and I'm going to tread carefully on this because I don't want to insult the profession, but some doctors simply are becoming a little lazy and they don't want to get involved because they're sick and tired of having to be told what they're going to make and what the money is coming in and what they have to do, and they simply are not as good at their job as they might want to be?
Well, I'm going to be very honest. It's not about laziness or cost. It's about the Hippocratic Oath. That's what this is coming down to. If you choose to be a doctor in this system, you lose the autonomy to choose to treat your patient the way you were trained to do so. You have gatekeepers, you have compliance issues, and it's no longer about doctor-patient relationship. It's about meaningful use. It's about following algorithms. And I, for one, my Hippocratic Oath is paramount. I took it, and it means something to me. And I intend to remain an advocate for my patients, and that's what the choice actually is. It's not about the money. It never has been for a doctor who cares about what they do. It's about being a doctor and being an advocate and taking care of your patient. And in this system, that is taken away from both the doctor and the patient, and that's really what's going on.
Is it impossible, though, in some cases, for you or any other doctor to have the Hippocratic Oath and to live by it with what you are being forced to do with Obamacare?
No, and personally, and I'm not alone, I've had to opt out of this system because it is a choice of practicing medicine the way I trained to do so and actually thinking about bean counting and cost cutting and having a patient be considered a cost center. This is about money. This is not about healthcare. It's about control. And whoever controls the pocketbook controls access. And under this system, the doctor and the patient both end up as losers, and the government and the insurance companies take over. They're running the system. You're paying into this system, and it's a bankrupt system to begin with. You can't put 30 million people into a system, promise them more, tell them they're going to pay less. It was never designed to work that way. And we're seeing rationing. Now, I don't know if you read yesterday, but there was an article saying that they're now paying, Medicare is now going to consider payment for end-of-life decisions, for hospice care, for counseling people to basically end their life sooner. So this is not a system that's designed to keep you healthy, designed to give you your heart's desire in terms of your healthcare choices. It's designed to limit them because cost is paramount.
Is it your fear, and perhaps you've even had personal experience or know of some stories where doctors are being forced to do certain things due to the Affordable Health Care Act, and it simply is dangerous for the patient, that there's a possibility that the patient may not get the coverage or the care that they need, and it may end their life sooner or create some sort of catastrophic event in their illness?
There's stories all over the country of that happening, but let's not be as alarmist about it as we could be. The bottom line is the healthcare delivery has changed, and it's gone from doctors being the front line to providers, where we have nurse practitioners, physician assistants becoming the frontline caregivers. And by definition, these are less trained individuals who don't know as much as an MD. They're in hospitals, they're in ERs, they are the frontline care. And by definition, it's changed over the past 15 years or so, and it doubles down under Obamacare. So I would say overall, the healthcare system is less safe. You're dealing with people with less training. Not that they're bad, but that's not what they trained to do. And we're having people who are put in positions where they don't know as much making decisions. And I think that's a problem for healthcare overall.
Is that the biggest issue right here? 30 seconds left. The people who are making the decisions simply aren't knowledgeable enough in order to make these decisions, and that's what really clogs the system and makes it dangerous?
Yes, and it also makes it expensive because they have to order tests because they don't know as much. So we have a lot of CYA going on. We have a lot of test ordering. And I want to be clear, it's not the physicians most of the time that's costing the money. It's more the hospitals and the way the system is set up.
Dr. Elaina George, every time we look at some of these studies, it certainly gets alarming for a lot of people right now who are counting on this and so many other things for their excellent health care. Honestly, sometimes We wonder how you doctors do it. But I do thank you at least for your absolute candid comments, and I certainly hope we talk again and maybe have some good news to talk about next time. Thanks so much.
Thank you so much.
All right, Dr. Elaina George joining us. Again, before we take the break, want to bring you up to speed then on the news that we are following. An ISIS video that has been released via the internet apparently shows the beheading of U.S. journalist Steven Sotloff. He would be the second American journalist that has been beheaded by ISIS. Also in this video, it is threatening the British captive David Haines that he will be next. We are following this story right now. It has been confirmed by the Associated Press and several other sources that the video is now out there. In just a couple of minutes, we will take a break. We'll come back. John Bachman will be here with Newsmax Now, and we'll check in and find out what the latest is right here on MidPoint.